For those of you just turning age 65, or perhaps you're over the age of 65, still young, but just retiring, maybe you worked a couple extra years, we are coming up on 2021 pretty quickly here. I'm going to be talking about the Medicare supplement plans for 2021. I'll cover the Medicare open enrollment period coming up and what you can change during that, as well as the Medicare supplement plans chart. We'll see if anything changed on that as well. And I'll cover the details of each plan letter that you should be looking at for 2021. If you have seen some of my previous videos, you know I like to keep things simple. I'm known as the guy who made it simple and cut through all the fluff. Our comments are great on our videos, and I thank you for all the people out there who have been so supportive and watching our videos and sharing it with your friends. Because again, I've been doing this 11 years and I love to make it simple. Now, who am I? My name is Russell Noga. I'm the founder of Medisupps.com, kind of the YouTube guy when it comes to this, and I like to make it easy for people, but I love to save people money on their Medicare supplement insurance. There's never a cost for anything we do, by the way. However, keep watching. I'll give my phone number soon, or you can visit Medisupps.com, where I always give free rates online. I'm one of the few people who shows you the actual quotes. If you put your name into the internet on just about every other site, they're either going to sell your name 10 times over, or they're just going to say thank you at the end. An agent will call you. I actually show you the rates. Anyway, enough on that. Let's talk about Medicare supplement plans for 2021. Well, the good news, unlike 2020, where we saw Plan F going away for new people, 2021 does not have any changes like that. There are no major changes to the actual coverage of Medicare supplement plans for 2021. Now, what does that mean for new people who can't get Plan F? You're not missing much. Trust me. And if you kept your Plan F and you're watching this, listen carefully. I'm going to cover Plan G and why Medicare Plan F versus Plan G. It's a no-brainer who the champ is. That is Plan G all the way. And then there's Medicare Supplement Plan N as well, which we'll talk about in more detail a little later in the video. That is rising in popularity. Actually, one of the most popular plans now due to its lower premiums than Plan G, but also has great coverage still. Now, I make these videos for two groups. They are the people who are turning 65 or new to Medicare. Again, maybe you're retiring and you worked a couple years later. And then there's a group who's been on coverage for quite a while, and you're just needing to stay up to date on the various information. So I like to start with the basics either way, though. It's a great refresher for you folks who have been here a while, but also for your new folks who need to know that this information is going to pertain to how it works with your Medicare supplement plan. So those basics are, you have what is called Original Medicare, or you're going to if you're just turning 65 or new to Medicare. Original Medicare consists of two parts. That is Part A Medicare, which is hospitalization coverage, and then Part B Medicare, which is doctor services. Now you would add a Part D drug plan to that for your prescription drugs. That is separate through a private insurance carrier. Part A and B are through Medicare. So you might be asking, where does a Medicare supplement plan fit in, or Medigap plan? By the way, it's two names for the exact same thing. You can call it whichever one you want. Medigap plan, though, it's called that for a reason. The reason is Part A and Part B don't cover everything for you. There are gaps or expenses, basically, of what they don't cover that you are responsible for paying. A Medigap plan helps pay most of those for you. Now, the Medigap plans are not parts, they are plan letters. Again, a lot of different letters here. It's alphabet soup. Medigap plans are lettered and they're offered by private insurance carriers to supplement Medicare Part A and Part B. Sometimes people ask me, Russell, can you have a Medigap plan but not take Part B? I want to save some money. Well, no, you can't, because you need something to actually supplement, and that is Part A and B Medicare. So those are the basics of Medicare and your what's called Original Medicare, and why we have a supplement or a Medigap plan. It's to help pay your bills, so you don't have to do it on your own. Enroll in one of these private Medicare supplement plans, and they can pay most of the gaps or expenses in Part A and Part B. Put a drug plan along with it, and then you've got the holy grail of coverage, so to speak. Now, the great thing about Medigap plans, Medicare supplement plans, because they follow Medicare wherever it goes, it's nationwide coverage. There's no network with these. These are not like Medicare Advantage plans. I've got other videos on Medicare supplements versus Advantage plans. You need to watch that if you're considering an Advantage plan. In fact, I'll put a link in the description below so you can reference that next. So you can see why we favor Medicare supplement plans over Medicare Advantage plans. But again, there's no network with this. Medicare is a federal program, so the supplement will follow it wherever it goes. I talk in my other videos of how many RVers I've got and how they're just traveling the country. Well, they always have coverage because they don't have a network. Medigap plans, anywhere you want to go as long as the doctors take regular Medicare. Now, one question I get asked quite frequently is, what is the best Medicare supplement plan? Or what are the best Medicare supplement plans for 2021 coming up, Russell? And I said, well, it's all about what's the best for you. Everybody has different needs and coverage. Now, in 2020, in my very popular 2020 video, that went off the charts and viral because I talked about how Plan F was going away for anybody new to Medicare. On January 1st, Medicare removed that from the lineup. People who had a Plan F could keep it, but the only way you could have a Plan F is if you were enrolled in Medicare prior to January 1st of 2020. Medicare Plan F paid 100% of the gaps, and if you folks have a Plan F out there, you know it was 100% coverage. It's probably why you kept it. But for new people just coming out of Medicare now, you can't get a Plan F. But again, you're not missing much. A Plan F, it was too expensive for too little benefit. Now let me explain. The best coverage now, or the most comprehensive coverage, I should say, see if it's the best for you in a moment, is Medicare Supplement Plan G. Now, one of those gaps that I told you about, or expenses in Part B Medicare, is a deductible. A deductible is simply an amount of money that you need to pay before insurance starts paying. Well, the Medicare Part B deductible is $198 in 2020, and it'll go up slightly in 2021. Well, with a Medicare Supplement Plan G, your only out-of-pocket expense for 2021 and beyond is that you need to pay the Part B deductible each year. After that, Medicare will come in and your Plan G will come in and pay the rest of your Medicare-approved expenses 100% for the rest of the year. That is fantastic coverage. Now, you might be wondering, well, Plan F, didn't that pay it for us? Well, yes, it does. Now, keep in mind, that deductible in 2020 is $198. If you currently have a Medicare Supplement Plan F, and I ran the rates for you for Plan F and Plan G against what you're paying and what you could be paying on Plan G, and I hope you allow me to do this because you'll be very pleasantly surprised, you are probably paying 3 or 4 or even more, $500 extra a year to get a $198 benefit. Meaning Plan F is that much more expensive than Plan G, and on Plan G you just write the $198 check yourself. So imagine paying $500 extra for a $200 benefit. That's a $300 difference that you're just giving to the insurance carrier. I want to see you keep the $300, and all you need to do is take 5 minutes and write the first $198 of your medical bills. Once those bills come in, write that and forget it. Now, folks who have a Plan F, sometimes they say, I never want to see a medical bill. I don't care what it costs. In that case, have at it. However, we should still shop your Plan F rate and probably save you money there by switching to a different company. But back to Medicare Supplement Plan G, that is why it is the most popular plan for 2021. You write that deductible amount, and in 2021, we don't know what it's going to be yet. Medicare doesn't release that amount till closer to the end of the year. I would estimate about $210 to $215, but we never know. 2020 is a crazy year so far. It depends on their own mathematical formula of what it's going to cost. We don't know yet. However, again, the rules remain the same. You write that first amount, and after that, 100% coverage on Plan G for the rest of the year. That deductible is a once per year calendar deductible. Now, it's got nothing to do with the insurance company. It's got nothing to do with Plan G at all. It's just simply before Medicare pays its amount. So once you, or begins paying, I should say. So once you pay that deductible, you're set for the rest of the year. It resets in January, though. So if you pay it in August, you've got 4 months of no deductible and you're paid. Come January again, if you go see the doctor, you'll just need to pay the deductible again for next year. So what about this Medicare Supplement Plan N you mentioned, Russell? Well, Plan N, again, very, very popular. I've got my own mom on Plan N since 2010 because it's got lower premiums than Plan G. But it doesn't quite have the same exact coverage. However, it's not bad, and it's got a few additional out-of-pocket expenses that you could get on Plan N. Now, what are those? Well, With Plan N, you still pay that Medicare Part B deductible. Because again, Medicare is not going to pay anything until somebody pays that deductible. You pay that with Plan N. Plan N doesn't pay the deductible for you. However, after you meet the deductible on Plan N, you might have a small copay each doctor's visit for the rest of the year. It will never be more than $20, but it could be less. It could be $9 or $13 or nothing. It just depends how they code the visit. One other thing on Plan N is if you visit the emergency room and you're not admitted, there'll be a $50 copay. So not a huge deal. They just want to keep people out of the emergency room for small things that are non-emergency. And then one other thing Plan N does not cover is called Medicare Part B excess charges. If doctors in this country, or doctors you visit, I should say, take the assigned rates for Medicare, meaning they accept Medicare assignments, they don't charge Part B excess charges. You'll never see them. And it's estimated that most doctors, even Medicare on their website, state most doctors take assignment. Not everybody, though. Some of the big clinics like the Mayo Clinic or MD Anderson, they don't take the assigned rates. So in that case, they could charge up to 15% extra of what Medicare deems the visit should pay. So you would have to pay a percentage of that 15% if that comes up. Not a big deal, not common to ever see these, but it's something that could come up. Now, coming up in October, we've got the yearly Medicare annual open enrollment period for 2021. Happens every year during October 15th through December 7th. If you have a Medicare supplement plan and you are watching this, call us now. You don't have to wait till October to change your plan and get a better rate. A lot of people don't know this. They think they have to wait until the open enrollment period. It's not true. We probably change 10 to 15 people a day, every day throughout the year, simply because they know that you can change every year or anytime during the year. So give us a call now if you have a Medicare supplement plan and you're looking to change. And most people want to change because they got that rate increase letter, that dreaded letter in the mail that says, hello, your premium is going up X amount of dollars. Well, you don't have to pay that. If we can get you qualified with another company, and it's not that stringent, I'll talk about that in a moment, we'll shop the rates. We'll look at all the different companies, match it up to what you're paying now. I just got off a call prior to making this video. In fact, I was late making it today because I was talking to a woman. I saved her $30 on her monthly premium. She had Plan G. All we did was change her to another company. She answered the medical questions, which is what you have to do. You have to go through medical underwriting to change companies. We know the underwriting guidelines of all the companies. We have a very good idea if you get through. Ultimately, they're the ones who say yay or nay and approve it. However, we've been doing this over 11 years. We know if you have a good chance of getting through. And I knew she would, and she saved $30. $30 a month for the exact same coverage she had. So what will change? The logo on the card and $30 back in her pocket. It's going to pay her cable bill. So it's like getting free cable now. You don't have to stay with the same plan and the same company. Give us a call and we'll be able to shop those rates for you, especially moving into 2021. But let me talk a little bit more about what can be changed during this open enrollment period. Again, Medicare supplements plans can be changed anytime. Well, during this open enrollment period, the biggest change and what keeps us working bell to bell every day during the enrollment period is people wanting off of their Medicare Advantage plan. They call us up and say, Russell, get me off my Advantage plan. They don't pay anything. I'm getting all these bills. I don't want to stay in this network. I want to go back to original Medicare and back on a Medigap plan. No problem. But you don't have to wait till October 15th to get the ball rolling on that either. We already have a huge list of people that we're switching. Call us today and we can get you started on that. You want to get in line, we'll show you what the rates will be, and we'll make it easy so you're not in the madness that happens. Underwriting departments get backed up like crazy, every company during the open enrollment period. But another thing you can change is if you're on a Medigap plan now and you want to go to an Advantage plan, you would have to do it during that time period. Also, if you have an Advantage plan and you want to change to another Advantage plan, that's the time period to do it, or change your Part D drug coverage to a different company or plan. You would do it during the open enrollment period, and all of those changes I just mentioned go into effect January 1st of the following year. So that about wraps it up for Medicare supplement plans for 2021. Again, no big changes, but you do need to know when you can change your coverage, particularly if you're coming off that Advantage plan. You want to come back to original Medicare and a Medicare supplement. But either way, whether you're switching supplement plans, you got that rate increase letter, you're turning 65 or retiring, we can help. Give us a call. We're licensed in 47 states. I can help you in the other 3 states because I've got partners around the country. Either way, we can take care of you, get you in the best Medicare supplement insurance now and for years to come, because you will get rate increases. When that happens, we shop the rates for you. There's never a charge for our services. So I'm Russell Noga with Medisupps.com. Give us a call today at 1-888-891-0229 or visit Medisupps.com, where you can get free quotes online and you will see the rates. Either way, we can help you, and we look forward to speaking with you soon.